Unplugged In, the global initiative to vaccinate everyone in the world against COVID-19.
There are no borders really anymore when it comes to these sorts of things.
Money is just one of the many challenges to get shots into arms in the poorest of countries.
COVID-19 has exacerbated poverty risks, and tens of millions of people will basically revert into extreme poverty.
Racing to the end of the pandemic by working together. Unplugged In, COVAX, and global vaccines. Hello and welcome to Plugged In. I'm Greta Van Susteren, reporting from Washington, D.C. The race to vaccinate the world's population against COVID-19 is in high gear. At least 7 vaccines have been approved for use worldwide, with hundreds more still being tested. 3 international organizations are working together in a global initiative called COVAX. Their goal is, in addition to fair access around the world, is to get shots into arms in the poorest of countries. VOA Steve Baragona explains.
Wealthy countries started buying the first COVID-19 vaccine supplies last year. How can lower-income countries compete? To make COVID-19 vaccine access more equitable, global health institutions developed COVAX. Rather than competing against each other, countries pool their resources. COVAX invests in many different vaccines, so countries aren't stuck if some fail. Each country in COVAX gets enough of the successful vaccines to cover a percentage of its population, especially frontline health workers and the most vulnerable. But COVAX has not worked as well as hoped. Countries are still making one-on-one deals with vaccine makers, taking up limited supplies. And COVAX is underfunded by tens of billions of dollars. In a global pandemic, new, dangerous variants can appear wherever the virus is allowed to spread. It's already happened in Britain, Brazil, and South Africa. If these variants undermine the vaccines, the world goes back to square one. Health experts say no one is safe until everyone is safe.
The United States has pledged $4 billion to COVAX. So far, COVAX has shipped more than 30 million doses to at least 57 of its partners. Among the organizations trying to help is UNICEF. Michael Nyenhuis is President and Chief Executive Officer for UNICEF USA. I asked him about the challenges of getting vaccines to those who need them most.
Well, it's a huge challenge, as you can imagine, but nobody is set up to do it better than UNICEF. Every year we procure and deliver about 2 billion doses of vaccines, childhood vaccines for under 5 kids around the world. We vaccinate almost half the world's children every year. So we know how to do this. We have the supply chain, we have the procurement mechanisms. We know that where the health centers are. We've trained the vaccinators. So we do know how to do this, but that's not to minimize the challenge that it is. Now, it's a little bit different for us because day in and day out, we're vaccinating children for basic vaccines for under 5s. This is going to be vaccinating first health workers, social service workers, vulnerable adults. So it's a different population base that we normally target. But on the other hand, it's the same supply chain, the same relationships with ministries of health, the same understanding of what's happening at community health centers, the same training needed for the vaccinators.
You mentioned that UNICEF vaccinates children typically, which is how I always think about UNICEF. Are you also gearing up for the possibility that you may be vaccinating children? Is that sort of in the distant future?
Well, I think that's probably in the future. We know that several of the vaccine makers are now beginning to test the vaccine on children. And so we'll have to wait to see what those results of that testing is. But one thing we know about children is they have not been the ones most affected directly by getting the virus and the symptoms of the virus. But on the other hand, they are the ones that are suffering a lot because of this. There are 180 million kids around the world that have been out of school for an entire year. And you can imagine how much that puts them behind in trying to make progress. We know that education is the route out of poverty. It's the route to a better life. And imagine all of those children out of school. It's disrupted supply chains for food and nutrition. There's economic impacts on families that have impacts on children. So, at UNICEF, our focus is the health and welfare and the rights of children. But until we beat the pandemic, kids can't get their lives back. And so we have to beat the pandemic.
Is it about distribution, or is it distribution and also getting the shots in the arm? Does UNICEF and COVAX just getting the vaccines out there, or also getting it into arms?
Yeah, well, I mean, ultimately into arms, right? So there's really three key pieces of this that all have to work together. Number one is the production of the vaccine itself. And so we're really grateful for all the companies that have worked on it and the governments that have supported that. We need more supply. This is the pinch point for us right now, is enough supply to get to the countries that we're focused on. But we're working with all of the companies to access as much vaccine as we can. The second part is the supply chain, to get it from manufacturer into countries, through ministries of health, down to health centers, and into the hands of vaccinators. So we're working on that piece, and there's many points where that can stumble, and we've worked on all of that. And then the third piece is to get communities ready to take the vaccine. So we have to confront vaccine hesitancy in these communities as well, just like we're seeing in some parts of our own country here. So we do a lot of training, a lot of community education to get people ready to take the vaccine, because ultimately you need shots in arms.
Any idea about how many vaccines COVAX has actually gotten into arms right now?
Well, we've been in about 50 countries so far, and tens of millions so far. Our goal is in this calendar year to deliver 2 billion doses through our supply chain to those countries that I'm talking about. So that's really just a down payment on it. That will get us the health workers, the social service workers, and some of the most vulnerable adults. And then we need to keep going from there in the next calendar year and speed that up as more supply comes in. We've got the supply chain in place. We can deliver. We need more supply.
Well, how do you determine which nation got it first, or which nation gets it before another nation?
Yeah, the first couple of weeks ago, when this all started, we started delivering the first vaccines were to Ghana and to Cote d'Ivoire in West Africa. We have a really interesting matrix that's put together on country readiness. That's looking at, again, the ability of the country to take how much vaccine, how quickly can they get it into people's arms, and put a lot of research and data into that, and have them kind of on a long list and working right down that list to get them where they need to be.
In terms of reception, here in the United States, there have been some people who don't want it at all, the anti-vaxxers, but most people do want it, and they're standing in line or trying to get on lists to get it, and the supply just has not yet met the demand. What are you finding in terms of like in the African continent? Are people lining up to get it, or are you still trying to get them to persuade them that this is a wise thing to do?
Well, a little bit of both, right? So, our population is no different than what you find in other countries. There are a lot of people who are desperate for it and getting in line and want to have it. And other people we're going to have to work on the hesitancy issue. We work on that every day anyway. Even, hesitancy about childhood vaccines. We know that's an issue here in the U.S. and it's an issue in countries where we work. We do lots of community information, call in community leaders to help promote vaccines, and we're continuing to do that around COVID as well. I saw an interview yesterday with a health worker in Malawi who'd gotten her vaccine, and she's been through, what she's been through in the past year in her hospital, mirrors what health workers in our own country have been through, and to see the joy on her face about getting this vaccine, which came through our supply chain and through the COVAX partnership, just really made me proud of the work that we're doing.
Sir, thank you very much for joining me. And thank you to UNICEF. I've been a big fan of UNICEF for a long time.
Thank you so much. Thanks for your interest in the topic and for your interest in UNICEF too.
The United States says it plans to loan 4 million doses of the AstraZeneca vaccine to its neighbors Canada and Mexico. AstraZeneca has not yet been approved for use in the United States. This offer to Canada and to Mexico comes as the U.S. is in discussions with Mexico to reduce the rising number of people trying to illegally cross the border from Mexico into the United States. The U.S. is coming under increased scrutiny by some for not sharing its supply of vaccine. Meanwhile, China and Russia are not letting a diplomatic opportunity slip away, becoming major vaccine suppliers to other countries. We have two reports. First from VOA senior diplomatic correspondent Cindy Sain.
Hope has arrived at this clinic in La Paz, Bolivia, in the form of Sinovac and Sinopharm vaccines from China. Bolivia, like other Latin American countries, has been ravaged by COVID-19. China says it plans to provide vaccines to 53 countries, including many in Latin America. China says it is taking the action to make COVID vaccines accessible and affordable for developing countries. Experts say China's sharing of medical supplies, after the pandemic originated in Wuhan, has given Beijing a diplomatic boost and also soft power leverage in Mexico, Brazil, and other developing nations.
China has been able to contain the pandemic within its borders more effectively than the United States and other Western democracies have. That means there's less demand for the vaccine in China, and it gives the Chinese government more breathing room to send vaccines abroad.
But Secretary of State Antony Blinken, while visiting Asia, cautioned there are strings attached to China's medical diplomacy, and most experts agree there is nothing soft about China's approach.
The way the Chinese are handling the vaccine distribution is not from a real magnanimous humanitarian attitude, but a pretty aggressive approach that essentially demands that Huawei get access to telecommunications auctions in Latin America, that Taiwan be held at arm's length throughout the region.
President Joe Biden has said he is focused on getting all Americans vaccinated before exporting supplies. But he did say the U.S. will share vaccines.
I've been talking with several countries already. Well, I'll let you know that very shortly.
Many experts agree it is not a question of America hoarding vaccines, while its Latin American neighbors desperately need them.
I think the notion that the United States is hoarding vaccines is overstated. I mean, the fact is that there's more demand than supply within the United States, which, along with Brazil, is one of the worst hit countries in the world.
Biden says he wants all American adults to be able to register for a vaccine by May, and he hopes people will be able to safely gather in small groups again for the July 4th U.S. Independence Day holiday. Experts say once that happens, the U.S. will likely become a major exporter of vaccines around the world. Cindy Sain, VOA News.
This is Charles Maines in Moscow. In the global battle against COVID-19, Russia's Sputnik V has emerged as a key choice among countries scrambling for access to life-saving vaccines. A glitzy social media campaign by its manufacturer backs the push.
So today is a great victory. Victory not just for Russia, but for the whole world as we are fighting the pandemic, and we use this V sign to celebrate our victory.
Sputnik V appears to have defied early skeptics. A recent independent review showed the vaccine with an efficacy rate of over 90%. It's a triumph of Russian soft power, say some observers, so long as the Kremlin manages to keep geopolitics out of the way.
Whenever the image of this is that we are great because we are beating Pfizer and Moderna, this does not actually help Russia's image. So people care about getting a vaccine, not about Russia beating the United States.
Russia's unique vaccine diplomacy has been particularly on display in Latin America, where Russia has promised millions of doses to much fanfare. That the deals come across the backdrop of American drug manufacturers struggling to meet their own export quotas to the region only adds geopolitical dividends, say leading area experts.
Latin America is important to Russian foreign policy, both in terms of gaining access to significant markets and making political allies amid a larger confrontation with the countries of the collective West.
Less clear whether Russia's promises to the world come at the expense of needs at home. Vaccines are widely available in Moscow, but distribution to Russia's heartland presents a more complicated picture. In Novosibirsk, the main urban hub in Siberia, residents pride themselves on an ethos of independence burnished by a cold and unforgiving climate. Yet local healthcare workers say amid a deadly pandemic, the mass vaccination effort in the area has struggled to keep pace.
The number of those hoping to get vaccinated outnumbers those we can provide them to. So, people will have to wait.
A recent poll suggests nearly 2/3 of Russians refuse to take the Sputnik V vaccine altogether, a reflection, analysts say, of overexposure to years of state media crackling with conspiracies.
The central reason, the key reason here, is that the government was spreading distrust.
The irony, when it comes to Sputnik V, past lies could cast doubt on today's very real scientific achievements. And it may keep Russians from recognizing a good thing when it's just a shot away. Charles Maines for VOA News, Moscow.
The World Health Organization has been in the middle of the COVID crisis since January 2020. In March 2020, the WHO issued the Declaration of a Pandemic and undertook a leadership position of the COVAX facility. VOA's Lenore Mudu spoke to the WHO Director General about preparing for the next pandemic.
A lesson in the past year, not only the national capacity in terms of preparedness and focus on science and helping politics to support science, but also the global coordination has to be strengthened, and also when we say global coordination, starting from early strengthening from early warning systems. Before even COVID, we have started transformation in WHO, and based on this experience, we will add more ideas to improve our system, and we have many mechanisms now, several mechanisms that is helping us to evaluate our situation in this pandemic and understand the lessons and then incorporate them into our systems, be it at national, regional, or global level, for future preparedness.
So far this year, Israel is one of the leaders in mass vaccination efforts. The latest numbers show just over half of Israel's population is fully vaccinated. At the same time, the country is coming under scrutiny as many Palestinians in the region have faced difficulty getting vaccines. VOA's Linda Gradstein tells us more from Jerusalem.
The stream of Palestinian workers did not stop coming at this checkpoint between Jerusalem and Bethlehem. Some arrived on their own, others were brought by their Israeli employers. They handed their Palestinian ID cards to the soldiers and were called into the vaccination tents. Inside, each worker received a shot of the Moderna COVID vaccine from the Israeli Health Service and a piece of paper with a date for the second vaccine dose. The workers seemed thrilled to receive the vaccine.
Everyone should get the vaccine to protect ourselves, our children, our families. I tell everyone they should get the vaccine if they can. We were supposed to get the Russian vaccine in the West Bank, but so far it hasn't happened.
Israel aims to vaccinate 8,000 workers per day over a 2-week period. But the vast majority of Palestinians have yet to get the vaccine. COVID-19 cases in the West Bank and Gaza are climbing, and the Palestinian Authority has imposed restrictions and lockdowns. Human rights groups say Israel must vaccinate all Palestinians.
Vaccinating only Palestinians that come in contact with Israelis and not all Palestinians living under effective Israeli rule under occupation reinforces that to Israeli authorities, Palestinian lives only matter to the extent they impact Jewish lives.
Citing the Oslo Peace Agreement, Israeli officials contend it is the Palestinian Authority that is responsible for health care in the West Bank and Gaza. But the Palestinians who came to the checkpoint to get vaccinated were more concerned about health than politics.
It is great that Israel is giving the vaccine to Palestinian workers. It's a matter of life and death. I come to Israel to work and then go back to my family in the West Bank. I wish my whole family could get vaccinated here.
Israeli officials say that if the Palestinian Authority asks for help with its general vaccination program, Israel will cooperate. Linda Gradstein for VOA News at the Jerusalem-Bethlehem checkpoint.
Findings from a new medical trial in the U.S. show the AstraZeneca vaccine is 79% effective in protecting from COVID. The studies also show the vaccine is 100% effective against severe disease and hospitalization. And Europe's Medicines Institute cleared the AstraZeneca shot from concerns about blood clots. It is the AstraZeneca vaccine that is most distributed by COVAX to Africa. Some healthcare workers say vaccine hesitancy and mistrust are slowing progress among vulnerable populations. Dr. Linda Mobula, a senior health specialist at the World Bank, joins us from the Democratic Republic of the Congo. I asked her about the unique challenges of combating vaccine hesitancy on the African continent.
Some of the reasons for the vaccine hesitancy has been due to fear, has been due to questions about side effects, as well as general distrust towards the outside world. I think there needs to be a lot that needs to happen regarding vaccine hesitancy, specifically focusing on community engagement efforts and risk communication, bringing clarity on what the side effects are, what the efficacy of the vaccine is, in addition to engaging with local leaders, community leaders, religious leaders, in order to better engage with the population, but also to really listen to the community and to understand their concerns a little bit better.
How bad has the COVID problem been in Congo?
So the COVID pandemic started in March of 2020. And since then, the Democratic Republic of the Congo has registered more than 27,000 cases. The case fatality rate is estimated at 2.6%. And Congo is experiencing a second wave of cases, as many other countries, since late last year. There's been a significant decline in the number of cases. However, positivity rates have remained somewhat elevated at 20%. So though we're seeing a decline in cases, there's still a risk for resurgence and for a third wave.
For the healthcare workers who are hesitant to get the vaccine, are they still willing to deliver the vaccine?
And this is a very good question. I think there's still a lot of work that needs to be done regarding engagement with healthcare workers, community health workers as well. I think one of the interventions that we're focusing on is training of healthcare providers to deliver the vaccine. And I think if you're not able to convince healthcare workers, it's much more difficult to convince the general population. And generally, most healthcare workers, I would say on average, about 20 to 30% have said that they are not willing to accept the vaccine based on the study by UNICEF. And one of the major concerns has been questions about side effects as well as efficacy. And so those are the two things that we need to focus on when engaging with healthcare providers.
Is the government engaging with COVAX, in a sense, in a public marketing campaign to talk about the vaccine? Are government officials getting the vaccine in public so that people could see that the government officials are doing it, and to try to sort of bring down the hesitancy?
Absolutely. That's a priority. Communicating about the vaccine, engaging with the community, ensuring that public officials receive it first has been a priority for the government. In fact, the Minister of Health has agreed to be the first one to receive the vaccine once it's launched in the next coming days or weeks. And so that's a really important factor. And that was something we learned from the Ebola outbreak as well. When the Ebola vaccine, the Merck vaccine, was utilized, it was really important that government officials, that public figures receive the vaccine to gain trust from the community.
Is there any sort of sense where you are that the Congo or other parts of the African continent are not getting what they should get? Are they feeling cheated in some way? Or what's sort of the sentiment?
So the Africa CDC recommends that most countries target 60% of the population in order to achieve herd immunity. In the DRC, for example, there might be enough vaccine for 25% of the population. COVAX is going to provide up to 20% in terms of targeting of the population, and the World Bank is going to purchase vaccines for up to 5% as part of phase 1. The African Union also plans on procuring vaccines. But most African countries, in addition to receiving vaccines from the COVAX facility, are required to have bilateral agreements with manufacturers, with other governments. And so in order to achieve the 60%, there is a huge need for these countries to receive vaccines from other countries in addition to those that they will receive from COVAX.
The United States has changed, I think, forever. It may be that we don't have to do social distancing and we may get rid of the pandemic, but you feel sort of culturally things have changed. Do you have that sense where you are?
Absolutely, Greta. I think one of the biggest impacts has been on the economy in addition to the loss of lives. COVID-19 has exacerbated poverty risks, and tens of millions of people will basically revert into extreme poverty. And this will reverse some of the gains that have been made over the past couple of decades. I think with regards to the impact on health systems, there's been decreased service utilization. There has been an increase in gender-based violence in the Democratic Republic of the Congo. Schools have closed. People have lost their livelihoods. Heads of households have reported increased unemployment, according to surveys done by the World Bank. And I think the impact of social distancing has been felt in a very significant way. Not always being able to see family. It has changed everything, I think. And that shift in terms of culture and these social practices, I think has had a huge impact.
Doctor, thank you very much for joining me.
Thank you very much, Greta, for having me on your show.
The coronavirus pandemic has placed an increased burden on the physical and emotional well-being of healthcare workers. In New York City, one artist is using his paintings to honor frontline workers in his community. VOA's Anna Rice tells us more.
Dr. Anthony Fauci didn't make Time magazine's Person of the Year in 2020. But this is how New York City artist Tim Okamura has portrayed Fauci the year the coronavirus pandemic hit.
And some of them you could see him looking kind of dejected. You could see him you could see Trump sort of in the background talking, and it was funny to see Fauci's expression and just trying to capture a sense of a sense of stoicism and intellect and thought, and sort of his presence in the the pantheon of American sort of personalities that have been at the forefront during this pandemic.
Okamura has also focused on nurses.
I'm living across the street from Wyckoff Heights Medical Center, which is absolutely full of COVID patients, and in fact, where one of the first COVID patients in New York was treated, and also unfortunately passed away. Yeah. So I was seeing medical workers going in and out of the hospital daily. I was seeing, their stress and the strain that they were going through.
Okamura adjusted his art to the new reality and learned to paint face masks and gloves. He dedicated special attention to the doctors' and nurses' name tags because most of their faces were covered with protective equipment.
As people, when we're trying to connect with somebody, you feel that there's kind of a barrier between you and that person, but the eyes are where you're going to find that interaction.
Jenny V can only be recognized when you look into her eyes. When she's at work, she always wears a mask. After working a 12-hour shift at a vaccination site, she says the vaccines offer hope.
It feels great because, it's signaling an end to a pandemic, hopefully, sooner rather than later. And it's nice to see that, people are coming in for it and, just excited to get it, just as excited as we are to give it.
NYU Langone Health lowered its flags to honor the COVID victims. Back in May, after V worked long hours fighting COVID, she found it hard to come down during her 2-hour drive home. That's when Okamura met her.
We were never taught in nursing school on how to handle a pandemic. So, when it hit, we were all, we were scared ourselves. We all have families, young children, elderly parents. And when the pandemic hit, we were just pretty much trying to figure out how to get by day to day.
V says while COVID vaccines are a light at the end of the tunnel is very long. She hasn't seen Okamura's portrait of her yet, just a picture on Instagram. When it's safe to do so, Okamura will give it to her as a gift, like he will gift the other portraits of medical workers as a way to give thanks and remember the pandemic's toll on human lives. For Vladimir Lensky in New York, Anna Rice, VOA News.
That's all the time we have for now. Thank you to my guests, Dr. Linda Mobula and Michael Nyenhuis. Stay up to date on the latest news at voanews.com, and do follow me on Twitter @Greta. Thank you for being plugged in.